Undergraduate Alumni Engagement. Today's conversation features Laura I. Appleman, Associate Dean of Faculty, Research Integrity Officer, and Van Winkle Melton Professor of Law for Willamette University's College of Law. Dean Appleman will share her research on how COVID has affected a whole range of individuals who are captive and vulnerable, including the incarcerated and those in nursing homes, mental institutions, foster group homes, long-term care facilities, and community corrections. We also will discuss relevant legal issues surrounding the pandemic as it relates to captive and vulnerable people who are often in high population residential environments. Dean Appleman, thank you so much for joining us today.
Well, thank you so much, Tiffany, and thank you to Willamette University for giving me this forum in which to share my knowledge. Tonight, I'm going to give you a brief blueprint of sort of what I'm going to be talking about, and I'll talk for about a half an hour, and then Tiffany has some sort of pre-planned questions, so not legal in the debate, but okay for tonight, and then I think we're going to probably open up for questions. So tonight I'm going to be discussing my latest scholarly project, and that's called Pandemic Eugenics. And in this piece, which theoretically should come out next year when I finish writing it, I'm looking at how we continue to follow what I call an invisible blueprint of eugenic philosophy in how we're approaching COVID in captive and vulnerable population. And so how I'm going to approach this is, first, I'm going to give a brief overview of the history of eugenics in the United States and how, in my view and in other scholars' view, this philosophy has never really gone away. Instead, it went underground after World War II. And I'm going to show, in brief, how we've always practiced eugenic philosophy, by the way, I mean America, our policies, on those captive and vulnerable individuals. And then I'm going to shift the focus to our current pandemic and specifically discuss how our approach to fighting COVID really has failed with three distinct groups of the captive and vulnerable. First group is those under correctional control. So that includes obviously people who are imprisoned, people who are in jails, but also those generally under lighter form of correctional control, supervised relief, halfway houses, rehab, work farms. Second categorization is those people in long-term care homes. Now, this of course includes nursing homes. It's not just nursing homes. It's mental institutions. It's homes for the developmentally and intellectually disabled. And then finally, I'm going to talk about children who are living in group foster homes. And why am I focusing on these groups especially? Because I've found that in a crisis, and in this crisis, we invariably follow this invisible blueprint of eugenics, which really directs us to dismiss and ignore those individuals we deem as lesser, whether they have been deemed so via the criminal process, because of old age, because of poor health, because of disability or family situation. Okay, so that's a pretty, I think, big charge to lay. So before I sort of escalate that, I want to talk a little bit about America's history with eugenics. And I sort of like to frame it as past and current. So this idea of eugenic philosophy has really, I would say, guided our past decisions to forcibly institutionalize the mentally ill, the cognitively and physically disabled, and sort of a looser category that I would categorize as the socially undesirable. And really from the beginning of the United States, even before when we were a colonial holding, the idea of segregation and detention has really been used to control those people on the margins. So the poor or minorities. So if you think back in our history, convict labor farms, later correctional institutions, the disabled, right? Originally in cages, then in asylums, and now still often in hospitals long-term care homes. And I really think if you trace it back, eugenic philosophy, even if maybe not characterized as such in the 1700s, really provides the structure for many of these decisions, and crucially still shapes the form of the debate today. And I want to specifically look at how we have a lot of scientific rationales which undergird eugenics and still continue to inform both law and medicine. And so because of this, I think it's particularly critical to understand them. Now, what's a really obvious one that I think has been discussed in the press? Well, this idea of fitness, as in who gets a ventilator, the priority list, who gets emergency medical protocols. You saw a lot of states, now they've never actually been implemented, but a lot of states saying, okay, so if you are disabled, if you are too old, if you have a quality of life that a panel of doctors do not consider worth living for them, you're going to be last on the list for a ventilator or other emergency protocols if someone younger and fitter. Now, that's gotten a lot of press, and happily we seem to have moved away from that sort of peak hospitalization. And everyone's, I think, sort of like, yeah, well, that's eugenics. But what I want to talk about tonight is how there's so much more eugenics lying underneath a lot of both our history and what we do now. So, all right, quickie refresher on eugenics, right? So Americans really invented eugenics. It was the phrase was invented by a man named Francis Galton, but it was really sort of an Anglo-American idea. And in fact, we developed such a robust program of eugenics in the 30s nationwide under the progressive regime, which we usually think of as a positive thing because, you know, they changed schooling and they changed, jails and et cetera, and modern medicine. But they also, we did such a good job with it that the Nazis actually learned about it from us. Now, they obviously they implemented it to a new level. On the other hand, okay, so World War II, afterwards, a lot of people who still believed in this said, let's not call it eugenics anymore, because that sort of has a Nazi tinge to it. But it really continued to persist in many forms. So I'm going to talk briefly about two major ways in the past that, and in the present, that this has gone on. So the first is medical experimentation on the captive and vulnerable. Now, we've always had a long history of experimenting on the captive and vulnerable, but let me just give you a couple of examples, both from, starting from the 40s and 50s and going all the way up, until 2019. So, for example, Jonas Salk, right? We all love Jonas Salk. But one of the depressing things about doing this kind of research is that these wonderful famed doctor figures left a little more feet of clay after you look. So he did infamously, took a bunch of, tested a sort of wild flu virus on a bunch of extremely disabled men at an army hospital in 1941 so as to get a vaccine for the troops. Likewise, the Atomic Energy Commission, and a lot of this stuff wasn't discovered and really till either the Clinton era or even more recently under the Obama era. The Atomic Energy Commission did a lot of testing about what happens when people are exposed to radiation. And then, so they famously or infamously, they did two major experiments. One was at the Fernald School, which is a school for children who are developmentally disabled, which at that point, of course, meant mild intellectual disabilities, ADHD, epilepsy. I mean, what they sort of, and a lot of kids were just sent away. And so they basically did a deal it was Harvard, Boston College, and Quaker Oats, where they put radioactive isotopes in their oatmeal, the boys' oatmeal every day, because Quaker Oats was concerned about competing with cream of wheat, and they wanted to see about iron absorption. And they theoretically got, consent from the parents, but obviously not. And so the other big things actually happened in our great state, Oregon here. So Oregon and Washington, infamously in the 70s, irradiated prisoner testicles with thousands of kilowatts of radiation to see what would happen. You know, just and so that's what our government was actually paying lots of people to do. Lots of doctors, lots of universities, right? I mean, so really no one, I think, is immune from. And you know, I think that was just all fine, right? This was not. I mean, sure, it seems horrifically creepy and exploitative now, but really, I mean, no, this really only recently have people said like, maybe that's bad. Doctors routinely experimented on the aged and poor. A lot of cancer experiments where they would inject cancer into old, dying, poor people to see what would happen, right? For the greater good of scientific exploration, right? I mean, how did we get all these vaccines? Well, hepatitis vaccines, famously at the Willowbrook School, they just let every child, there's again for severely disabled children, get hepatitis, which of course is not necessarily fatal, but is not a great disease to have because they figured, well, they'll get it anyway, and this will be good. This will be good for society. The other one, there's so many I could mention. In fact, I wrote a whole paper on this, but the other one I'll mention is what Dr. Albert Kligman and the University of Pennsylvania infamously did at the Holmesburg prison in Philadelphia, where he tested what is now Retin-A, right, which many of us use to make our skin nice and smooth, tested it on prisoners for a little extra pocket money. And there's actually a whole book written on this called Acres of Skin. And all these prisoners now have horrific cancer. And really, you know, I mean, they even later, like Kligman is still very well celebrated at the University of Pennsylvania Medical School. Like none of these doctors have really been, so we say, knocked from their pedestal. Okay, but you might say, well, gee, that's in the past. Well, here's some stuff a little more recently. So in the 80s and 90s, New York tested age drugs on foster children, whether they had HIV or not. A lot of these very sort of potent recombinant cocktails, very toxic, you know, they were there. No one was really watching out. Likewise, in California, very recently, there was a lot of testing of psychopharmaceuticals on, once again, foster kids, right? So a lot of doctors have a deal with the pharmaceutical companies. And of course, you know, these are experiments run through universities, and there's a lot of money in this. And so why not? Why not give these sort of very strong drugs to children who may be, you know, acting out because of trauma and not necessarily because of mental illness? Stanford infamously in, I think it was the 1990s, tested Depakote, which is technically an anti-seizure drug, but is used for some mental illnesses on California Youth Authority kids, so juveniles who were imprisoned in juvenile detention, so just to see if they would behave a little better. And then most recently, in 2019, at the Glenwood Resource Center in, I think, New Hampshire, one of the doctors was actually doing experiments on sexual arousal among the patients who were extremely disabled. So suffice it to say that this stuff happens all the time. It's just not quite as naked. The other big thing that I think we still see is sterilization programs in many states. And of course, always, as soon as we could do a sterilization, which is usually a hysterectomy on women, occasionally a vasectomy on a male, this was focused on the poor, on minority, on disabled, people who shouldn't breed because they were not fit enough. Now, I think we all, or many lawyers know about Buck v. Bell, and where Oliver Wendell Holmes famously said, you know, 3 generations of imbeciles aren't enough. I think what most people don't know is that Buck v. Bell is still good law, never been overruled. It has been relied upon relatively recently in 8th Circuit Court of Appeals. And so this whole, you know, I think there's an idea that sort of after Skinner, which says you can't have mandatory vaccinations in the 40s, we stopped sterilizing people. Absolutely not. There was the states, especially in the South, sterilized so many women, Black women, they called it a Mississippi appendectomy. Similarly, in Puerto Rico, which of course we also, you know, controlled for quite a while, there was something called la operación. And for a certain amount of time, I think in the 50s and 60s, every woman between like 30 and 60 got la operacion because they did not want what they felt as US government did not want undesirables reproducing. You might think, okay, well, that's in the past. Well, no. So California continued to sterilize female prisoners without their consent until the 2000s, right? So not that long ago. We constantly see things like, requirements to be sterilized pop up in plea agreements and in sentencing, sometimes even in family law, in custody. If you say, well, you have too many children and you can't have any more because you can't, and we're going to throw you in jail unless you either stop procreating or, have yourself snipped. And that's very common. Finally, I think, as many of you have seen, recently, a month ago, 3 weeks ago, we heard about illegal, unconsented hysterectomies done for undocumented citizens at the border. So again, eugenics. Okay, maybe you'll grant me that there's still what I call a long tail of eugenics. And it's still, it's gone underground, but it's still there. So, okay, but you might be wondering, well, how has that affected our approach to COVID in these captive and vulnerable populations? And that's what I want to spend my last 12 minutes on. So again, I'm going to attack this in sort of 3 tranches. The first tranche is treatment of those under correctional control. And in most of my discussions of this is going to be more of a nationwide description. And then I have some more specific Oregon-based answers for the Q&A that Tiffany and I are going to have. Okay, so you might have seen, or you might have realized that being imprisoned is not great if you want to avoid COVID. Why? Well, prisons and jails, let's just talk about those for a while, first, are infamously overcrowded. Even though, the federal government took over California's prisons, it's still really overcrowded. Maybe people aren't dying quite as quickly pre-COVID, but it's still overcrowded. And so there's no ability to social distance. There is little to no PPE. Maybe the guards have a little bit of PPE, but a lot of prisons won't even give masks. They're afraid that the prisoners, and I read, let's just blame California because, hey, we're Oregon. I'm pretty sure it's a California correctional facility officer saying, well, we can't give people masks because, they'll take the metal strip and they'll shank someone. There's nothing to clean with. There's nothing to sanitize. Moreover, prisons and jails have very limited healthcare, right? You think you have struggles with healthcare out in the free society. I guarantee you that healthcare is far worse. Now, federal prisons are a tiny bit better, but not that much better. Moreover, many prisoners and jail inmates are already in poor health. If you think about who goes to prison, well, mainly minority men who get more poor health care before they go into prison, and then prison doesn't really help. The other thing, and maybe this is why I think, if you're not concerned about the plight of prisoners and inmates and people under correctional control, well, what's the biggest driver of community spread? Prisons, right? So this is true in Oregon because when prisoners and jail inmates get COVID, they give it to the staff and the staff brings it out. So if you are concerned about, putting down the spread of COVID, then you should at least be concerned for this. Now, many, many, many inmates have died. It is very difficult to get an accurate count because not to put too fine a point in it, people lie. So there's UCLA has a sort of COVID count just for California. And they are, they're really having difficulty getting accurate numbers. As of tonight, this is the most, recent I could get. There's been 132,000 cases within prisons and jails, and at minimum, 25,000 deaths. And I would say that's probably massively undercounted. Now, jails are even worse because at least with prison, it's a relatively stable population. Jails, of course, you're held under a year. And you also hold people who have been arrested but not yet convicted. So we have legally innocent people in here. far worse healthcare, much worse overcrowding. Now, a few states in response have tried to release inmates from jails and prisons. So California did a little bit of this. New York did a little bit of this. Overall, 21 states did a little bit of this, but not much compared to the general incarcerated population. Moreover, even if these people are released, often they have nowhere to go, right? Maybe they're released to the streets, right? What's something I'm not talking about in this paper, but I certainly could, is what have we done about the homeless population in COVID? Not much, right? Which is sort of the answer to all of this. And so, very briefly, alternative corrections, work farms, rehab, halfway houses, just as bad, even more under the radar. I mean, most people don't even realize that these things exist. Okay, so we haven't done a great job with correctional control. Well, how about nursing homes? Nursing homes have been in the news. Oh, wait, why have they been in the news? Oh, massive deaths, right? Nursing home deaths have simply been a disaster, a tragedy. Now there's focus on it after thousands have died. Now, New York, I have to single it out as maybe the worst policy ever. So New York has come out now to clear out its hospitals and make the numbers look better, had a policy of sending still sick but not actually dying residents of nursing homes back to the nursing homes out of the hospital as soon as possible, which of course infected everyone in the nursing home. And of course there's a variety of lawsuits about this, which may or may not. Nursing homes, FEMA has never sent any PPE. It's fun to point fingers as a law professor. That's clearly my job. It's not me, it's you. But I think we can point to the federal government and the state government here. So FEMA never sent any PPE. There really were I can't look at any state and say there are any good federal or state policies. I think nursing homes were pretty much left on their own. Finally, some nursing homes are even doing a little medical experimentation on the side. So one nursing home is doing some experimental testing with hydrochloroquine. That's a great drug. Another drug company, I think it's called Regeneron. A lot of drug companies have these little side drug companies that are, have different cool names, and they're trying other, and of course, technically they're trying to get consent. But sometimes if you ask someone who is not fully understanding, especially if you are very ill in a nursing home, that's not really informed consent. So I think it's safe to say we have not done a good job with nursing homes. Mental institutions, well, more of the same, except this gets even more complicated. Many people who are institutionalized for intellectual or developmental disabilities don't understand social distancing. A lot of the staff are staying away. So you have staff who are basically living there. Again, not much PPE, not much sanitizing material. And really the amount of trouble that that these staff have for just explaining, right, what's going on, but also trying to control has really been, I would say, devastating. And of course, with mental institutions, almost zero tracking. It is literally a black box. Finally, and I see I have 5 minutes, right. Finally, let me talk a little bit about foster care group homes. So, it's all horribly upsetting. This, for whatever reason, makes me the most upset. So these are kids who are in the foster care system and cannot be placed with families or their own families because they have a lot of problems. They are very much at risk. So they live in these group homes, which isn't always so great in the first place. It's particularly bad now. These kids are locked down, right? They're not allowed to go out. The social workers, so in California, the social workers union said, hey, we want to protect our social workers. Don't go visit them. Well, okay. That does save social workers. However, it has been catastrophic for these kids who now only get to see, people through videos. A lot of them are also still having contact with their birth families. That's shut down. Again, very little PPE. There's been a lot of isolation. There's been a lot of eloping, right, which means that they're running away. There's been a lot of suicide attempts. And so these, I guess, 3 groups of people have really been almost completely ignored, except as an interesting news story, right? And, you know, look, for a lot of this information, I really had to dig. I mean, I'm no investigative journalist, but I do know how to find local news, right? And it's really local news, I have to say, props to local news, who are finding out a lot about this. And, you know, and it's very hard for me not to sort of see the same line coming from, I mean, especially when you see, oh, medical experimentation, right? The same line. And I think lack of care over people who we really feel that are others, right? That are not fit and they're not healthy and they're not contributing to society in sort of a very Protestant work ethic society here. And really, they've just been completely ignored and neglected. And I don't think we'll ever get a really good count on how many people have died. I mean, for a variety of reasons, some of which you can fill in yourself. But I particularly do not think you will get proper numbers from people who are captive and vulnerable. And, you know, sort of the second part of my paper, which I have not yet written, is what can we do about it? Both in terms of focusing on, well, what happens next time? Hopefully there's not a next pandemic, but you never know. But also, you know, I do feel, and this is sort of a third in a series of articles where I've talked very bluntly about, oh, look, hey, there's some eugenics there. I mean, I do think, you know, as a professor, you know, if I have any sort of societal job besides, you know, sharing learning with my students, it's to, you know, expose this kind of eugenic philosophy for what it is. Now, I'm certainly not the only person who is pointing this out, but it's been very, very recent. There aren't that many other scholars. And so, it's 6 o'clock, so let me stop here. I mean, you know, I could certainly go on for 5 more hours, but I'm going to hand this back to Tiffany.
Thank you. And I just know that's so much to unpack. There's the historical context. There's all of the things around our value judgments as a society and the fact that we often think people that are in these situations have somehow brought it upon themselves.
Yes.
And that comes to what, you know, kind of our political will and motivation around finding some really equitable solutions for helping mitigate their vulnerabilities and the danger that they may be in. When thinking about that, are there some different ways? So you kind of painted a picture about what the current conditions are and gave some examples, but are there different ways that authorities are reacting to COVID right now as it relates to the rights and treatment of captive persons? Like things that you can kind of drill into where they're either being ignored or things are just being completely set aside?
Some states have done a better job than others. So, you know, I mentioned some of this before. So California and New York at least tried to release some people from jail. There's always backlash to this, right? Prosecutors don't want this. But let's talk about Oregon for a minute. Not to throw Oregon under the bus, but just to show what we as a state has done. So in April, Governor Brown announced she would not be releasing large groups of people early over concerns about COVID-19 because our Department of Corrections, this is a governor's call. Our Department of Corrections presented Governor Brown in April with numbers showing she'd need to release about 5,800 inmates to create enough social distancing inside just the prisons, significantly reduce risk. So roughly 40% of the state's prison population. Now, to be fair, no state has done that. Governor Brown has done even less. She's released 123 prisoners, and that includes the 60 she released last week. So the Oregon Justice Resource Center, which has advocated, and I have to, you know, really, I mean, I'm not saying that there's no one paying attention to this. There are some fantastic policy centers, both in Oregon and nationwide, who are really, you know, trying to bring light to this. They have really fought for more releases, really since the pandemic began. I can't give them enough credit. They were just refused. So as of late September, in Oregon, we've had 972 inmates and 258 staff infected, 9 deaths that we know of, right? And it's unclear what's counted as what. Now in comparison, our great neighbor to the north, Washington, they released 1,100 prisoners, approximately 6% of their inmates, we released 0.4%. Governor Inslee, Willamette law grad, let's feel the love here. He commuted the sentences of all prisoners convicted of non-violent offenses who released states fell prior to June 29th, 2020. So Washington, bigger state, more prisoners, has had only 772 cases. And if you, okay, so, and how do we count the impact? Well, do we just say deaths? I mean, I think we've seen a lot of interesting information about, long-term effects of COVID. So for me, it's not just about deaths. Of course, it's also about community spread. Now, most of our prisons, I think, are still in Salem because of some, quirk of the legislature. But yeah, so if you live near a prison, or if you have a lot of community members working in a prison, then your community itself is not as safe. And so why? I mean, I really don't know. I know the Marion and Multnomah County, at that point, Multnomah County prosecutors were very pleased that prisoners were not released because of public safety concerns. And more than that I don't know. So, okay, we did okay on nursing homes in that we've had some bad ones, but we didn't actually send infected people into the nursing homes. I think Vermont, with their veterans home is they fired the head and is being sued because so many people died just from sheer ineptitude. So we've had 226 cases at 3 facilities. So Laurelhurst was a very early site of nursing home illness and death, but it's always in comparison. Now, I will say the Prison Policy Initiative, which I actually it's a saved bookmark for me. So they have a lot of great graphics, and if I was at all competent with graphics or PowerPoint, my students know I'm hopeless at this, I would have showed you that. But anyway, they rated all of the states on how they did on releasing prisoners. And I think the highest was a D+ and the lowest was an F-. So no state has done well. We haven't done as badly as other states, but we could have done more. I mean, in terms of, nursing homes, I mean, that's a little harder. Most nursing homes are not state run. Most of them are private, unless it's a veterans home. Foster care, I haven't been able to find any information about Oregon foster care. Now, Oregon foster care has been in crisis for the past 15 years. So I have some speculative guesses, but I just don't know. It's always easy in hindsight to say, gee, you should have done more. To be fair, a lot of people were saying this in the beginning of the pandemic. We should have done more. And I think, look, it's not even just these 3 sets of people. It's just these are 3 sets of people that I'm focused, types of groups that we've ignored the homeless. We've certainly ignored disadvantaged children by shutting down schools and saying, oh yeah, you can just learn at home on your own with remote schooling. And, too bad if you're 8 and your mom has to work. So many drums to beat. It's so little time. So I think that was a really long, there's a question I think you had like 5 hours ago in there somewhere.
Well, no, I think you covered so many of the following questions. We had kind of, what the Oregon response was, how that compares to other states across these different lines of populations when we're considering the impact. And so the other question is really, do you think that there's a way for local entities or county level entities to respond to this? Right now, a lot of the response has been state level because the federal response is non-existent or has been very, limited. So are there other things tools people have to maybe mitigate some of the harm or press some of these issues? So
as always, it depends what we're talking about. So we're talking about prisons, that's a state thing. Jails, still mainly a state thing. Alternative corrections, though, is different because a lot of these alternative correction sites are actually owned by private companies, private for-profit companies. I have an article about that too, completely tangential to this. And so that presumably could be pressured. I think that would be difficult. These companies are not out, they're not in these industries because of love and care of people, to put it mildly. For nursing I mean, I think Oregon, although sort of slow to the mark, has done everything it can. I mean, I think they certainly have tried to get. One of the tragedies of nursing homes and FEMA. So FEMA finally, like last month, sent all this PPE, and it was sort of all over the New York Times, like giant garbage bags or PPE suits with no armholes. Like you have all these pictures of the staff and nursing staff. I mean, one thing, of course, we could do is actually pay the staff on a lot of these places, whether it's prisons or jails or alternative corrections or nursing homes or mental institutions or long-term care homes, pay them more, right? I mean, these are people who often do these very, very hard jobs and get paid very, very little. And of course, then they also are part of the casualty list getting sick because, they're not paid well, and they're often not in good health. So, money always helps. I mean, it's a tough one to ask right now. As for foster care, that's run by the state. I believe that there are a lot of people in the Oregon foster care system, certainly in Portland, who are really doing their best. I mean, I know a lot of people who are working in it, individuals and stuff, and they are doing their best. Also money. I mean, I hate to be sort of, money, but that would help. I mean, do we need more state and federal regulation? I mean, it's ironic because my students always hear me railing about the administrative state, but here it might not be a bad idea. But while we're at it, we need a lot more stronger controls on informed consent and medical experimentation and sterilization. I really don't think this should be that. I mean, this violates things like the Nuremberg codes, right? I mean, after the Tuskegee study was done, remember, where they sort of let people die of syphilis to see what happens? When we found out that we had also been infecting people in Guatemala with syphilis, recently, I mean, there are things we can do about that. We need to, I mean, this is sort of a different topic, but, I think we do need to have a lot more regulation. It's very, very loose on both medical experimentation among people who are, more vulnerable. I mean, it may be paternalistic, but having seen what people do, I'm okay with that. Yeah. The problem, of course, is that this is a many tentacled thing, and I think there's so much that needs to be done. But I'm focusing on these groups because these groups really have. I mean, they're really almost voiceless, right? Unless someone is writing an article about it, we're not going to know. And I mean, that really is profoundly tragic that in the 21st century, we're still saying, okay, we're going to treat you and give you, better health care and maybe the right to live or die because we are making value judgments, as you said, about what your life is worth. If you're convicted, and of course, this is a common problem, right? If you have a conviction, then you're not, and you're either in prison or out of prison, your life is worth less. If you are disabled, right? We have we have the ADA, but the sort of the laws, people have tried to sue, either stop the ventilator rationing or other things, and it's sort of a patchwork, right? So, I mean, a lot of people who maybe a doctor would say, well, your life isn't worth living. Well, part of the same parcel. I mean, again, look, I'm not a doctor. I'm not an epidemiologist, nor do I have any power, nor do I want to be like, hey, state this. I mean, yes, I am going to say that in my paper, but, I appreciate it's easy for me to point and say, hey, you've done the wrong thing. So maybe I'll sort of leave it on that we really need to be a lot more aware of what our past history has really shaped us to do subconsciously, right? Again, this sort of invisible blueprint sort of guiding us in a way that we're not even thinking about it. And if that is the result of the scholarship, then at least we're aware of that. That's a start. I don't have any easy answer because there aren't any.
Yeah. Well, and I think that you're using your expertise to kind of support the agency of some of these groups that really do not necessarily have visibility, political influence, and their own agency, however that's defined. We did get a really interesting question that I think kind of speaks to the many tentacles where, do you think part of the problem here is the fact that there are so many areas of law that are involved in this, whether it's crim pro, immigration, healthcare, is it really that you have to tackle all of these different things to kind of address one issue that is very complex?
I think that's right. I mean, I think some of this research has really led me to go down in areas where I clearly am completely unqualified to comment. I mean, if you sort of grant me, well, fine, crim pro, but I mean, I'm not a health law scholar. I'm not a disability scholar. But then these problems, right? So as a former criminal defense attorney, this is sort of the combined problems that we see. And so I do realize it's overwhelming to do it all at once, and so maybe we need lots of people working together, and dare I say, a commission, right? I mean, we have a couple of years ago, the governor appointed a public safety commission to sort of review things like bail reform, and so maybe we need another one, not so much for public safety, but for public health, because I do think that, the OHA, Oregon Health Authority and stuff, that they got their hands full, right? I don't think they're sort of sitting back and sipping margaritas here. So, I think, and maybe one of the things that results from this, like we've seen from other, tragedies, including the Atomic Energy Commission, which, by the way, has, if you're interested, has literally 3,000 pages worth of documents on the internet. Hard to find, but not that hard to find, saying, yeah, oops, they're not really that sorry, but they're a little sorry. And so, maybe we need to continually have these public reckonings. I wish we didn't have to have a coronavirus pandemic and all these deaths and suffering to have this, but I think it is essential if we're still, the democratic society, we need to shine light upon these things and have a bunch of people, experts from all fields come and talk about it.
Yeah, it's really interesting how a crisis situation can kind of pull the veil back on things that we have just let people experience if they're marginalized and
Right.
They're institutionalized. We don't have to address it. We don't have to engage with those populations per se, or even think about it as day-to-day citizens.
Right.
One of the questions that came in that's really interesting, because it kind of drills down, we have some alums that are criminal defense attorneys, and they are having little success with COVID arguments or justifications when it comes to release hearings or sentencing. And they're wondering if you have any idea, resources or information or things that you might recommend or start with.
I mean, say in Oregon, that's a Sisyphean burden. We're just not, and California has stopped. I mean, I think there's a sort of an understanding, well, things have gotten better. And I mean, no, not in prisons and jails. They actually haven't. But I mean, I think with that, quite honestly, you have a lot of fear of public safety, right? I mean, this is always about sentencing, right? That, why we lock up so many people because of fear. And so, I think that a lot of politicians who run this don't want to take on this right now, and because there's so much backlash. I mean, I think that I wish I had a better answer. I really don't. I mean, both places like the Brennan Center and the Marshall Project, and of course, again, the Oregon Justice Authority. It's just frustration that I'm seeing. I wish I had some or good or any answers, but unfortunately, I just don't.
Well, and I think it's something where it's so new that unfortunately we're still kind of going through the process of how we're going to address that, and then the reckoning that might be coming our way for any inaction or wrong actions that are taken right now, and hopefully will inform us to be better the next time. Not that there's no hope right now, but I also wanted to kind of look forward. Are there things, when you look at your research, where else you're kind of digging into this? Are there things that you think you want to explore a little bit more, or could see there being some developments that might help mitigate some of these things in the future?
Not to end this on a completely depressing note. So there has been movement in sort of the criminal justice space sort of pre-COVID. So one thing, that I talked about last week in a different presentation, is bail reform. And there's been tremendous movement on bail reform in the past 3 or 4 years. And it's been a completely community groundswell movement. Now cities, states are beginning to do it, but really it just started with community funds. And so, I mean, Portland, I think, especially in Oregon, is full of a lot of passionate people about things. And so, is there a way that, sort of a community group, starting small, could look at these things, right? Because, do you demand a commission, right? Maybe we don't wait for the powers that be to say, hey, I'm going to, appoint you. And then, maybe it's just, as much of a street roots thing. I mean, I think there's, we saw with, I think, a lot of the protests for police brutality, that people have had enough. Now, maybe this is, I understand there's a lot to be upset about right now. There's a lot of work to do, but maybe, and I think this very much ties into what I, think of as the structural racism in the criminal justice system, especially if you look at, prisons and jails, and even to the points of, who are in, the state-run veterans homes and who's in the foster homes, right? It is the powerless, it is the poor, it is the disadvantaged. And so, maybe this is an extension of that. And, I do feel that people can get together and make a change. And we've seen this, right? We've seen this right now with, people saying, oh my goodness, that's criminal procedure? You've got to be kidding me. I'm like, I've been telling you this for you, but something that criminal procedure professors know, but maybe others don't know. So again, this idea of, it's almost like a sunshine law, like, the disinfectant of sunshine coming in on this, just knowledge. I understand we may have a couple of other things to think about in early November. So I understand we're all busy, but I think we all do our part to continue the fight. And this is sort of my very small way of at least aggregating the information that might be hidden. And so, hopefully that will, make some change.
And so in thinking of all this, is there anything, we only have a few minutes left. We've jumped all over because this is such unfortunately, there are so many people that are in vulnerable and captive situations. And so it's a multifaceted issue. Is there anything that you want to circle back to or elaborate on a little bit before we, kind of close out in the next few minutes?
I think, I think I've covered all the issues. I would just, remind people there are so many people in the community who really feel they are invisible, and they're suffering. And, I've sort of highlighted the particularly at risk, but I think there are a lot of people who are suffering because they don't feel they're given full value by the community for various judgments that we make. And I think a lot of that is societal, and I think a lot of it, again, is subconscious. And if nothing else, this should make us a little more aware, because the reality is that you can't just say, oh, well, they're sick, they're going to die, so that's fine, I'm okay. Because it's actually not, because this is what we call, again, community spread. So, maybe the force of the very transmissibility of this coronavirus and the pandemic is going to force us to really acknowledge those that perhaps we would have ignored under less stressful times.
Yeah. Well, and it's also one of those things where, it's not a comfortable issue to think about, to explore, to learn more about. So I really just want to say how thankful I am for everyone who joined us this evening to kind of dive into this. It's one of those things where growth and you're cultivating your own self-awareness really comes from getting out of your comfort zone and digging into issues that can just feel overwhelming in the middle of a crisis and everything else that people are considering. Someone just asked, are there any specific current regulations that would be helpful and that are not currently being adequately enforced?
There are lots and lots and lots of federal and state regulations, and they don't really do much. That's really so there's a part of the paper that I did not share with everyone because it's these sort of really hard legal analysis. And there's a welter of, health law, disability law, well, prison law is just, the answer is generally no, you don't get to do that. There are a lot of people and a lot of policy places who are trying to bring suits and enforce regulations. Here's one that I know has not been successful. It's a little tangential. So students right now who have IEPs, who need, have a federal right to their educational needs being met, well, Oregon's all remote. Are those needs being met? No. Are there several nationwide, I'm not sure if it's a statewide lawsuit, but nationwide lawsuits enforcing that? Yes. Is anything going to come of it? Not an education law thing, but I think it's very hard. So yes, there are a lot of regulations, but it's, even if you are seasoned advocate, it's very, very hard to enforce them, and at least in the way that I would like them to be enforced. And of course, it comes back to time and money. Each state and the government just doesn't have that much of it. So that's a good question.
Well, and hopefully the people that have joined us today will get a little bit more interested in this, and then can maybe help, bring their own influence to the issue, and then that'll cascade. We can only hope.
Thank you for all of you for spending your Wednesday evening with me and my completely real personal library. Yes, that's where I live, in that. It's great. I love it.
I think we get to create the reality that works best for us.
don't we? Don't we wish? Yes, I'd like to live my alternative reality forever, but alas. No, and I think, what I've written on throughout my career has been painful and uncomfortable and awkward. I guess that's what I enjoy writing on, but even just to engage in it, I think is important. Get people thinking. Maybe smarter people than me can figure out some solutions. I just want to sort of put the problems out there for everyone to see.
Well, and keep bringing that sunshine, even if it's a difficult process, to keep getting those news sources together and sharing those stories and those examples in a way that people can digest them and take them in, and then hopefully use them in a way to benefit their clients' lives and put their expertise to bear on these big issues. So we will, just so that a lot of people have been asking where the articles are. So we will make sure, everyone, that we send an email with a couple of different links and share that information after the event. Dean Appleman, thank you so very much for sharing your insights and knowledge regarding the legal issues surrounding the legal implications and impact COVID is having on people in a variety of high-density residential institutions. If you enjoyed this discussion and would like to see more webinars as well as other exciting Willamette content, continue to turn into WooStream, our virtual programming platform. Thank you so much for joining us.